Hi, good afternoon. Welcome to the meeting of the Aging Committee for Community Board 8. My name is Mary Ellen Gibbs. I'm the Chair of Aging. I'd like to introduce, we have the Chair of Community Board 8, Julie Reyes. District Manager, we have Farah Kuehl Rubin. And we have Artie Ardmere for our office. And we have community members, and we also have David V. Pomerantz with us today. So I'm gonna do roll call. Mary Ellen Gibbs is present, Barbara Kale absent,
We're waiting for George.
and we're waiting for Georgia Santiago. So I can just like skip over the minutes and go to chairperson's report. So in the chairperson's report, we're gonna be traveling all over the place in the community. We're gonna go different facilities, different older adult facilities to introduce to the community board so they can know that we're here. And they can get an idea of all the stuff that the community has to offer for older adults. A lot of older adults don't know what they have for older adults. SCREE and all kinds of programs that is offered to them. So they can get information from us. We're also gonna be working on the older adult resource guide, which you can come and get a copy in the office. We'll be handing them out in events. It tells you all about stuff they can get, like, oh my goodness, I'm tripping over my words. My first move.
Facilities,
You know, facilities, home care agencies, all kinds of information for like SCREE, all kinds of information for older adults that they can use for their life. We want to get the word out about SCREE. Most older adults don't know about DREE and SCREE. You turn 62 and you can freeze your rent as long as you live in a rent stabilized building. And it's a lifesaver because rents are getting so high and a lot of seniors they can't afford to live in their apartments and everything. And so that's one of the things that I have for my chairperson's report. And so the best part of it today, I get to introduce David V. Pomerantz, our speaker. He is a new CEO of River Spring Health. Did I get that right, David?
Living.
River Spring Living, you think? Yeah, River Spring Living. And I'd like to introduce him and he can tell us about himself and.
Good. Thank you. Thank you for the introduction. Of course, we know each other for a long time, and thank you to all being here today and those on Zoom. I'm not new to the organization. I'm new to the role. Here 40 years, just about. And next May will be 40 years. And I like to tell people that one day, instead of going home, I'll just go in the elevator and go upstairs. I might not know when that day is. I might think I'm going to a meeting, but in any event, I've had a really blessed career here. Started pushing wheelchairs in 1985 when I was going locally to school at Manhattan College. I lived in Riverdale my whole life until I got married, so this community means a lot to me. I have a lot of respect for this committee in particular because of the work that I do. I really appreciate you're being dedicated to focusing on aging, elderly, whatever we're calling it today, but people who have really done some great things in their lives and deserve the attention. Bill Stone was a good friend of mine, an important member of this community and big focal point in a lot of these committees, and actually lived next door to him when I was first born, and we were friends until he passed. I'm still close with his wife. I was there for the dedication of his street. So this community means a lot to me, and this organization means a lot to me. We are in a bit of transition, as most organizations like ours are. Medicaid reimbursement is really insufficient to provide the resources that we get. About $300 a day under Medicaid. It costs about $400 a day to care for a patient. Really doesn't work. You can do the math and you realize we have 600 beds and we've been doing this and it just doesn't work. So we're going to always have Medicaid nursing home beds. It's a commitment we've made and always will make. But we're doing things to sort of supplement that. And we've started to do some assisted living services on campus. And, we're going to build River's Edge, which is a new property, which you know well about, which will take place presumably in the next 2.5 years, it'll be built. So we're trying to do things to diversify. So we're not dependent upon a funding stream, which would be insufficient. Many not-for-profits like us have gone out of business. If you think of back and the local providers, the Beth Abrahams of the world, And you think of some of the not-for-profits, Morningside House, I could give you a long list. There's just very few left, because it's just not sustainable. The for-profit do it a little bit differently. They don't have the same quality standards. I don't want to disparage them all. There's some terrific ones, but a lot of them don't do it the way that we do it. And so they have a different economic fortune than we realize. They also take a lot of subacute patients out of the hospital and get Medicare funding as opposed to Medicaid funding. So it's a bit of a different economic model, but for us, we have to be diversified if we're going to continue to exist. We started 1917 in Harlem, moved to Riverdale in 1951. And so to maintain our mission and continue, we have to change. And that's part of what my new role is. I've had about every other role in the place. So this is now my job to chart a strategic pathway for us, which will be sustainable. I had a call with the state today. I speak to the state often about how we're maneuvering and changing some beds from nursing home to assisted living, and they're fully supportive because they want us as one of the highest providers, highest quality providers to continue to exist. And we can only do that by making some changes. So we're doing that, but we're still the same organization that you know and you love. We've cared for so many people in this community over time. And frankly, we get people from outside of our community differently than most places. We have people come from Florida, from all across the country, and sometimes internationally because of the standards of the kind of care we provide here. We're a leader in dementia care. We're a leader in technology, which is kind of our newest twist. Had a donor who's incredibly grateful for the care we provided and made a significant donation to allow us to bring in technology. Technology these days is imperative for all businesses. You can't go to anywhere and do anything without technology being part of it. And that's also true in our environment. So, for example, we have a call bell system here now that when you push the call bell, by the way, call bell's #1 complaint in every nursing home, every hospital in the world. If you've ever been in a hospital and you push the button and you sit there so in our system, when you push the button, you immediately get a caregiver who answers you on a cell phone that she carries for the shift. So she can triage, you're nervous, you fell, you don't feel well versus, I need the remote control or I'm thirsty or something that could wait a few moments. So they can be much more efficient in what they do. That's been a game changer for us, as well as a number of things we brought in terms of robots, which you saw in our gym,
Cool.
and robots in our gym to help people with mobility. So if you've had a hip fracture, you go to a place like us, over the years, you'd have 2 rehab therapists giving you a bit of a wedgie when you're walking down so you don't fall. Now we have a special called a zero-G machine, which you go into and it prevents you from falling. Nobody has to hold you. It's a harness, it's a robot, and you walk. We tell you to fall because you can't. We build the confidence, and then you can start to walk and get healthy and get out of here quicker, which generally is the goal for people that come in, have had a hip fracture or something. So technology is a big part of our future. It doesn't replace staff. It enhances the work that we do. We're trying to innovate all the time and bring joy to elderly people. We believe very strongly in this organization, always have, that it's a place to live, not to die. It is ultimately the place where people will die most often who come here. But while they're here, new relationships, new hobbies, new things to do, and we push very hard push people to live their best life, even when they can't express it themselves. If they're suffering from dementia or something, we try and get them out, some of which you saw today, to do fun things. Even if they aren't able to articulate why and what, they're able to participate and enjoy those activities as well. So, we're a big hirer, big employment, and we're probably the biggest in Riverdale. Not the biggest in the county, but we have, a large staff that we care for in and out of the facility. We take care of 18,000 people in their own homes through our home care division. So we employ a lot of people. We try and do a lot of things to make life better for people. We're very focused on caregivers. It's not just the client, or the resident or the tenant, it's their caregiver. It's the caregiver doesn't get the support that they need, they can't be that caregiver. So we do a lot of support groups and trainings and things to enhance their ability to do the roles they have, which is a difficult one. Many of us in our lives have been caregivers. I was for my mom. It's not easy and you need support to do it. So we try and do a lot of this well. People live in the Hebrew home, River Spring, whatever, we call ourselves River Spring Living because we have so many people that aren't in Riverdale or aren't Hebrew, but it'll always be the Hebrew home to many of us who've worked here for so long. But people live here are of all faiths. We have all levels of services. It's a place where everybody can come and feel comfortable and enjoy. Catholic services, Baptist services, Jewish services, all kinds of things going on all the time. We work primarily with New York Presbyterian Hospital as our hospital partner. We're clinically affiliated with them. That brings us a lot of value in terms of their medical expertise. Doesn't mean patients can't go to Montefiore or come here from Montefiore, but that's the system we chose to affiliate with, so we do a lot with them. They're the doctors on our rehab floor, so people who have a fracture of a hip in a hospital, the same hospital system, medical records come over to us, and they feel that they have continuity of care. So it's not like they're stopping and starting. They feel like they're just being transitioned to another part of the same care plan.
Connect the Epic system?
Yes. Yeah. So do a lot of things with them. I guess I'll take questions. I don't want to drone on if you,
A couple of things that I saw, I thought was really cool that you implemented the CNA program, so you don't have to go to an outside school. I noticed that you guys are now having the program where you can actually take the course to be a CNA.
and for very obvious reasons, staffing is an incredible challenge. And if we get people to do their training here, they're not forced to stay here. But we have the opportunity to show them our best cards and show them who we are and say it's a cool place. So, yeah, we have a training program with the state, allows us to do certifications for CNAs. Yes.
And I mean, like, write my little notes. Another thing I had seen on the TV, you always encourage, like, romance for older adults. And I just saw a couple just got engaged, which I remember him. from-
Al, he was
Al,
in the room, he got engaged, yes.
They got engaged. That was like amazing.
Interestingly enough, I heard a story yesterday of the woman he was dating before he got engaged, who's not happy he got engaged. So, a good story doesn't have a little bit of there's a jilted person involved. Yes, there's a education here on sexual expression that has gone on for many years to respect people's right to choose. We work with SAGE. If you know what SAGE is, LGBT, we have a whole program to let people be who they are and to make the choices they make, whether they're pursuing relationships or things on their own. Staff are trained to give privacy and to respect people's right to make a choice.
That was a funny, because they said, well, what happens if you walk in the room by mistake? And Dan was like, you turn around, you walk out quietly and close the door.
The issue with all that stuff generally is not the people themselves. It's the family who feel uncomfortable that their mother, father might be engaged in a new relationship. And it's the staff who sometimes bring their own values and think it's inappropriate for somebody to have a relationship when they're not married or same sex or whatever. So we do all of those.
I always thought it was so cool that everybody paired up and stuff.
Yes.
And is it this, it looks like it's gonna be like the same model you see in California, where you can, like, when you're building that new place,
River's Edge.
where you're, River's Edge, I'm sorry, I forgot to,
That's
I went
okay.
blank a little bit,
Yeah.
have not seen your moment, because tomorrow is a big senior day for me. River's Edge.
65 is the new 35, forget it.
40, please.
No, So I just can't.
About
believe-
screen
I can't
62, I'm
believe-
61, you gotta.
I know you were a little younger, but it was so funny though. I can't believe how much time went by. But in California, they have the models like River's Edge, and you live in that
The
apartment.
life care model, basically,
model.
yes.
But then it goes down, like, say you can't live that style anymore. You can go to like assisted living. From assisted living, when you can't take care of yourself, you can move into the.
The hope is that people come here, live an independent life as long as they can, and when they need supports, they have a fall, they go to rehab, they need assisted living, eventually they might need nursing care, that they come and they can get all that here. Also, keep in mind, when people move with a spouse, people don't age the same. The aging process for people is rarely identical, so it might be that the wife continues to be independent and the husband needs assisted or vice versa. I don't want to be negative to the men, there's so few of us left at a certain age. I like to tell a story if I could, that, when Riverwalk is independent living, it's an apartment building right here, and when a new man moves in, it's noticed, 'cause the population is largely, so if a man moves in, I like to tell people, he might have a different knock on the door every night from somebody else.
So is Riverwalk going to remain part of your group versus part of the life care community?
So it's all us, it's all me, I'll be running all of it, and yes, it will stay independent and it'll be where it is, yes.
It's interesting, when Dan Reingold presented the CCRC originally to the board several years ago, one of my concerns was just being a forever resident of the community. you want to make sure that it's still available for, I'll just say, as I grow older, right? But with for life care, of course, priority will go to the residents who are guaranteed continuous care as their needs change. Will there, I think Dan had mentioned, well, there's so many beds that it shouldn't be a problem that the community and other people who aren't part of the life care program, you know, that they'll be able to find a bed should they need it in assisted living or in Riverwalk or in the nursing facility.
Yeah, it's sort of all actuarially based of studying numbers and knowing how many people will need and so forth. But yeah, I mean, the truth is you never know what's gonna come. And, you know, at the moment when somebody needs it, is it that moment when there's nothing available? We hope there'll always be beds available, whatever the level is that somebody needs. But the reality is, you know, it's hard to say, right? Because,
As the years go, it'll be more and more difficult as you have the turnover, but.
yes.
A few more questions.
Go ahead, go ahead, go ahead. You have the
I want to
floor.
give you an honest answer,
You have
though.
the
It's
floor.
really, the truth is you just don't know, and
Yeah.
we certainly will always want to take care of our community, and so if it's not that bed, hopefully it'll be the next bed, but you don't expect everybody's gonna age out at the same time, in the same place. We're building more assisted living beds, we'll have more variety there. Riverwalk is not a small building, it's 137 apartments. So we will hope we'll have enough for people both internally and externally.
And the units in Rheingold are mostly single, I think. The model in most long-term care facilities are, you'll have a shared room, right? I love the model of the sort of family model, household model, where you have each person has their own room with a central living and kitchen and whatever. Is there any thought, you know, that might be in the cards that, so more people can have their own private room who are in nursing care?
It's a great question, because I wouldn't move into a place if I didn't have a private room. It's a big factor, and it's changed during my 40 years here. When people came many years ago, they wanted the company. You know,
Some people would.
yeah,
do that.
I mean, when I first started here, I had a woman who lived on one of my floors, and she'd been here for 30 years when I started working here. And of course, there were no resources at that time. You know, there was no assisted livings and home. She had no place to go. The answer to your question is, that involves a lot of construction and a lot of costs. So the reality is, if I could build from scratch, I'd probably build something like you're talking about right now, but to augment the buildings as they are would be very difficult. So I don't think it's likely we'll have that model here at play.
House Project.
Yes. Yeah. But I love it. I love the concept of it, but
The homes, as you were saying earlier, you know, it's where people live. It's not just nursing.
yeah, absolutely. I wish I had a better answer for you, but
No, I get it.
I mean, you
We
know,
have a lot of beds already, but hopefully.
you're talking about a different model of aging, right? A model of aging which is reflective of people's independence and, you know, and not the older model, which had sort of the racetrack set up and the shower room and all that stuff.
Yeah.
That's ancient kind of, and that's why we're moving away from doing so much nursing home, because we can't really meet today's population's needs that way. People who are coming into the nursing home yesterday are people that are coming into assisted living today. There's other resources for people. They stay home longer, they do other things. But the people that I see in assisted living today are the people I recognize as the nursing home people from yesterday. And in those, you have those different kinds of apartment setups and bathrooms differently than you would in the nursing home. And we have both Medicaid and private pay
The
versus.
shower rooms are really, they've gotta go.
Yes.
but-
Oh,
You know, over years, you try and make them pretty and you put new tiling in, you put music, it's still a shower room. Where you're going down the hallway in a towel and stuff, and it's just not,
because I'm weird about sharing a bathroom, like.
I don't, most of us are.
The,
You have another one for me?
Come up with it soon.
a lot of people are asking me about, recently, like, if they want to go away, there's a family want to go away and they have an older adult that they can't take with them, they're asking about respite.
We used to have respite here for years. We don't anymore.
Oh, you don't
The
anymore?
cost of doing the assessment and getting everybody to learn who the patient is and getting
It's like a
involved,
short time, right?
it's just not worth it to do it.
What is that? I'm not.
Short-
You know, you're painting the house and, you know, you needed to go somewhere, or a daughter want to take a trip and she's caring for her mother and she needs a little bit of a break and she'd bring her mother for 2 weeks, 3 weeks, 4 weeks. And we had it for many years. It just, yeah. Just economics.
But you have the home care now,
Yeah.
right? So I guess you could send people to.
We do that all the time,
Yeah.
sure. It's expensive for people. Sometimes they don't mind that. It depends, you know, we care for people on Medicaid and home care also. So it's a range of people. We have people where cost is no issue. And they have 24-hour care and sometimes more than one aide, 24 hours a day. So depends.
Since you have the CNA program, would you have the med tech program for the aides and stuff?
You know, the state is funny with that program.
Yeah, cause I've seen it other places and
So just a little
it's
on
hit and miss
MedTech,
on it.
the state wanted to, looked at the possibility, since it's hard to get CNAs, to get aides. They want to allow people to become trained other than nurses, so that the aides jump in. When you get the aides, give them more value, give them an additional stipend and let them participate in MedPass, and it didn't happen. There's a shortfall of staffing, nursing, CNA, rehab across the entire country. I won't speak for the world, but across the country, people just can't get staff. The competition for that level of worker now, called an entry-level worker, there's so many more options for them. Fast food places are paying more than they ever did before. And people say, do I want to do this kind of work, which can be emotional and taxing, or do something more light? And so all of a sudden you have a real competition for people that were sort of entry-level positions are much harder to find than they were. They also leave. I do orientation every week with I meet every new staff member who comes, because I learn about how they come to us, who they are. And very rare to meet somebody who's been in 9 places already. I worked there for a year, I worked there for 4 months. They just move around all over the place. They don't stay like they used to. Longevity is down. The generations are different. I have 2 daughters and I love them dearly, but their expectation of work is different than mine when I came here. You know, you tell me to do anything, you be here at 9 o'clock at night, there's a party or meet somebody, I'll do anything. And, you know, the generation today is more like, what are you doing for me? And where's the free lunch and what's my perk? It's different. I mean, I sound like a resident.
Except for our-
I'll
except for
talk with the
our-
bridge. I'll tell you how much the bridge cost. And we had to toll, I remember 35 cents.
Yeah, right? It was 10 cents when I moved to Riverdale.
It's changed. That's made it harder.
Right? Does anybody else have any questions? I'm sorry, I see Georgia, you're on the line. Do you have any questions for Mr. Pomerantz?
I would like to know his name because I was trying to get in and I didn't get his name before he started to speak.
Oh.
You
Great.
said it's Pomerantz?
Yes, David Pomerantz.
Oh, David, let me write that down. I was just curious because I got in, you know, I was able to get in, but I just wanted to ask your name
Thank you.
because I heard, you know, everything else.
Okay,
And thank you.
thank you.
I have a couple of questions. Oh, by the way, I'm Sharon Asherman. I'm the director of the Older Adult Center at the Riverdale Y.
Okay.
You might
What is
have
it?
seen your name around
I
it.
love the Riddle Watch. I used to play basketball there all the time.
Yeah. Yeah, you're actually, I don't know if you still are, but on our emergency plans, somebody to go to it. We haven't had to use you a call on you, but somewhere I saw your name. Okay.
We're here.
Yeah. So I just have a couple of like unrelated questions. So, or maybe they are related. So this shortage of the CNAs, is it like, what is being done about it since it's national? What are there policy implications? Are there proposals on the federal level to deal with this? Or is this something that's just gonna be like swimming upstream for the next 20, 30 years?
You know, I don't think there's a good answer for it. First, you have to recognize you have a problem before you solve it. I think everybody recognizes it now and they realize the population is getting older and there's more and more need. I think there's got to be some economic changes to make it more advantageous to be more competitive with some of those other jobs, because it's not easy work. I mean, the CNAs here do really amazing work. It's taxing, they're not always treated well. Sometimes other people get frustrated and angry, so it's not easy. And I think they're gonna have to do something about it. Most of them are in the union. They're 1199 union members. We have a very good relationship with the union, and I think the union is gonna have to continue to advocate for higher wages for facilities so we get higher pay standards. We just did a 6% increase for the CNAs last week. That's my contract. That's not just us. That's 11-9 across the board. I think you need to do more and more of that to make it advantageous to do it. Working conditions are, I think, as good as they can be. It differs by place to place. We treat our staff very well. I think not every place does. How many patients they're asked to care for? Do they have the resources to do their job? Those are key questions that I listen to every week from orientation, because in some facilities, they don't even have the proper diapers and things to use, and that makes their job much harder. So I think there's changes that have to be made outside of our arena,
Mhm.
politically and financially. I mentioned the Medicaid rate. I mean, it's ridiculous that the rate is what it is. The
Wow.
Medicaid system is overtaxed. Frankly, and I'm talking to the right group of people to make this comment, but aging isn't sexy oftentimes for funders. They're not generally voters. We're a voting district here, and we believe very strongly in promoting people's ability to vote, but they're not the most active people, funding wise and so forth. So I don't think they get the attention in this country that they deserve and the resources behind it. I'm not suggesting the Medicaid system should go crazy, but I think, we had one increase in the last 20 years to our Medicaid rate. And the rate we got was not even sufficient. So you're right, it's a problem, and I think it's becoming more and more apparent. I saw some commentary about, and I'm not being political, but there was one of the two candidates talking about getting Medicare involved and supporting home care initiatives.
Right.
And I think there's an attempt to say that we gotta look at the system. It's not working for older people. And I think certainly as an aging committee, you know that the issues are different from an aging population. They don't have all the options and freedoms, and their economics are reduced. It's unfortunate. The money they get from the government as a stipend, when they're on Medicaid per month is like $40.
Mhm.
They can barely go to the commissary and get a couple of items. It's just not good. I'm sorry if that was a long-winded answer to your question, but.
So I understand there's waiting lists for, I guess, all over, especially for people who are like, I guess, PA3s, people who may have dementia, but are otherwise independent and need to be on a supervised unit. And I guess that if you're cutting down on Medicaid patients or on the people who need like nursing, who can't really live in independent or assisted living, which would be that some of it is people who need high levels of care, but also some of the people who really don't need much care, but the wanderers or the people who are just confused but can take care of their ADLs, that there's going to be less beds for them and longer waiting lists.
There are gonna be less beds everywhere for that because it's an incredibly complicated dynamic to care for those populations.
Right.
Let's talk about the fact that, first of all, many of them, and I'm doing this a long time, and my own mother had dementia, so wandering behaviors,
Mhm.
exit-seeking behaviors is the biggest penalty we can get as a nursing home and anyone like us. Obviously, our responsibility is to keep people safe and to whatever, but with the staffing shortages and people's ability to walk and to move, just because they have dementia doesn't mean they're not physically fit. As you know, oftentimes they're in very great shape. It requires a lot of attention to make sure that you're paying attention to where they are every minute. And in my time here, 40 years, we've had people get out of here. And the stories I could tell you of being here all night, and thankfully, none of them had bad endings, but they had very stressful, and the state does not look at that favorably. If somebody were to wander out and they were to penalize you, it's called an IJ, immediate jeopardy. And that penalty comes with, they don't pay you for anybody who comes into the facility for a period of time until they feel that you've justified that that'll never happen again. You talk about hundreds and hundreds of thousands of dollars and legal fees to do that. So people are very scared to take in populations like that. Aside from that, they're not easy. There's a lot of behavioral issues that come along with that sometimes. Anger, frustration, striking out. When residents get into conflict with each other, which happens more than you think, generally they have to go out for some kind of mental health intervention. They're back within 5 minutes. They go to an ER, they're given Haldol, they calm down for the moment, they send them back. There's no working on medications to titrate to get them to an appropriate level. It's the greatest challenge in our field of the mental health aspects of the care services. So that population is not desirable economically for people to take them, and programmatically, it's very risky to do it. So you're finding less and less people. There's more and more people like that. And, nursing homes aren't always the best place for those people. There really isn't a great place because in nursing home, you're trying to tell people all the time to go over there, sit down, get out away from the door, and that sometimes exacerbates the behavioral issues. Again, I've worked in this a long time. It's the most difficult thing we deal with. And again, we're not reducing that population, reducing the total number of beds. We'll still have it. I could take you to see a bunch of them today. So we'll still take in people like that, but just at a lesser number.
Because you're taking in less than everybody.
Number of beds will be reduced for people with dementia.
For overall beds will be reduced. So proportionally our dementia, most people, I'd say, I heard the statistic this week, 75% of the people live here in any floor have some level of dementia. So dementia is everywhere, but in terms of dementia units, yeah, we're gonna have less and less people living in here from a nursing home perspective. You're gonna go from 600 or so down to 348 people living here in the nursing home.
One of the things is recognizing that it's still called exiting.
It's the behaviors, yeah.
So I really learned that exiting behavior. I was walking home from work, I was on Johnson Avenue, and I saw this woman, and she's walking around and she's looking. And all of a sudden I went, oh, that's very nice, isn't it? And I just started having a conversation with her to really get a feel whether she's supposed to be out here or not. So then I said, oh, by the way, my name is Mary Ellen, what's yours? She goes, oh, I'm so-and-so. And then I said, oh, you live around here, right? She goes, oh, I won't say a facility name, but I live at the facility, but I really hate it there and I'm going home. I said, oh, boy. So what I did was I just kept the conversation, and then she was looking, while she was looking, I'm on my phone. I called the place, I go, you missing somebody? I said, I'll wait until you get here.
Good for
But
you.
yeah, it's amazing. I mean, even when I was first a home health aide, I remember the bands and looking, I'm going, and I just started working in home care. And I said, this lady's not supposed to be down here. So I walked up and I said, can I help you? And then I was just sitting talking. And then you could see she was catching on that I was also, she goes, get away from me. And she said something that was really funny. And I brought it back. She goes, I want my lawyer. And I just, okay, he's upstairs. And I walked it back up. But recognizing that in the street, that these people are exiting or they're missing from their homes is such a great idea to even learn for ourselves.
They can appear completely appropriate. We've had, one of the cases we had here was somebody went downstairs, got off the floor and said, need a ride, I'm going home. And somebody was leaving with having visited, so I'll give you a ride. And they're out the gate. And so you really have to stop people at the gate and make sure who's leaving and.
Legislative perspective, for units like the greenhouse unit, which might be perfect for this population. Just higher reimbursement rates or something. I'm just trying to think of
Yeah, I mean,
advocate for
it's
a way to take care of a population is going to be growing.
ultimately, as much as you hate to say it, economics plays into everything, right? So if you can afford to do it, I wouldn't be reducing my nursing home beds. It's not that I want to do it because I don't think it's important. I'm only doing it because I would have to close the whole place. We'd be out of business. So yeah, you're gonna need to have people to understand, and I don't know if it's like the mental health crisis that we saw in the 70s, where you're gonna need to have some things happen where people realize that this is not a model that's working. I do think we'll get to that crisis point at some point where people are gonna realize that this model doesn't work as it's currently constituted, that they have to put some money into it and make sure that it's different. People have paid into their taxes, they've done all the right things in their lives. There comes a time where they need care, and the fact that there isn't sufficient resources and circumstances for them is disappointing. The other countries who do a lot more for, there's a facility in Amsterdam that I fantasize. You know the one I'm talking about?
Yeah.
I fantasize
A whole
about it.
town.
I fantasize about doing it.
Yeah.
Hey, why not? Try
If
to.
I could build on the lawn and there's limits so we can build these things, I would build it because I think it's amazing. What we're talking about is I don't want to call it a fake city, but it's
Some Sunday morning or 60 Minutes or some.
these people with memory impairment live thinking life is normal. They're in their units and there's a grocery store and a movie theater and a bus that goes in circles and they live as if it's normal. And it normalizes their life to the capacity you could normalize life for somebody who's impaired, but it's really cool to see that
Walk around, be outside
they
and.
literally go to the grocery store, pushing the cart and then they're not cooking anything and it's not, but gives them the dignity and the feeling that.
Now you see how you've grown from what you came from transportation to CEO of a company. why not you be the person
I'd love to
to
do it.
try and work on
Yeah,
something
it
like
would
that?
take a lot of space to do it more than anything else. I could get the resources, I believe. It really would be more about space.
Shoot for it, why not, right?
My biggest donor who gave me all the money for technology, I showed her a little video of it. I'm trying to sort of get her excited about it.
So cool.
We'll see. I'm 61. I'm not sure that's gonna happen.
You can get it going though, and then we can say,
Maybe I'll live there and.
we can say David Pomeranz got that started. And one of the things I did speak to the Bronx Borough President about over the summer at the barbecue was, I would really like to maybe do a resolution to getting more money, like for maybe go to the state and everything to see if we can get more money, like for CNAs, home health aides, that needs to be funded more because it, like you said, if you can get higher salaries and different, it'd be more attractive and you could fill the staff.
Well,
better.
1199 works hard at that. They're very important in helping both the mayor and the governor and everybody get elected, and they're the right group to do
Right,
it.
yeah.
They run commercials. They're trying very hard to raise the awareness.
She did say, she goes, you're 1199, right?
Any other questions for me? I don't know if I talked too long or I don't know.
Not a, very good.
Because I hear you say about the Medicaid, are there certain, certain percentage of beds available for either the lower or middle class?
There's no limit on anything. Most of our facilities Medicaid, but there's no limit. We don't say there's a Medicaid bed or a private pay bed. Whoever comes to our door, we take care of. There's the reality is most people are spending down their money before they come to facilities. In my span of life here, most people have set up trusts, go to law attorneys, they divest their resources, and they come to us on Medicaid. We had a private pay population here back in the 80s, which was big and strong, and people would spend their last 400, 500,000, $1 million here, and then they would go on Medicaid. Today, they come to us already impoverished.
You're not on Medicaid, you can't,
Pay privately.
what if you can't afford it?
Well, then you're really gonna work towards being on Medicaid. I tell people, Medicaid, which was a stigma for many people over years, is an advantage for people when they get to be older and they need to divest of their resources. So if you have a little bit of money and you want to come here, you would just use up that money and go on Medicaid or surrender that money and go on Medicaid. But there's no other options beyond that.
Just Medicaid. A shame.
Except for the CCRC.
Yes, well, that's a private pay model, right? That's same way we have assisted living. We have a private pay assisted living, which is expensive, and we have a Medicaid assisted living. So I mean, it just, there's something for everyone.
I mean, I'm talking about, because I wouldn't want to be on Medicaid, and then I know I don't have that money, so I'm in the middle. What about us?
Yeah, right?
I
Not
got-
just in this arena, in life, being in the middle is tough, yeah.
That's why I continue to pay my SAG dues, just in case, and I can go to
Never
the
know.
big
I was thinking maybe a certain percentage for the middleman, a couple of beds just for us poor folks, but not that poor.
Well, you could look, depends how you look at what's middle, right? So if you look at Riverwalk and you say,
We're all low over there. There's nothing affordable for people like me.
well,
The working person I'm talking about, like the average working person.
but if you take River's Edge, which will be at the higher end of the scale, and you look at Riverwalk, which will be at the lower end of the scale, there are differences in what people are paying. It might not be the numbers you're looking for, but there are ranges within what we charge private pay for different things.
It wouldn't be, because when they did that presentation to us years ago and we said what's affordable, what they considered affordable is not realistically affordable for the working. But probably everyone in this room, maybe except, I would say maybe for everyone in this
What
room.
about the apartment building on Johnson?
If we could point out,
Hey,
I was waiting to see where you're going.
you may get a discount for working, but all of us probably.
Wait, I'm the one.
Remember you were my friend as a kid, do I get a discount?
I'm just
What about the
asking,
Johnson Avenue
I'm
apartment?
asking for the working class people,
The Hebrew of the apartments on Johnson, is that a hub, is that part of the
That's
city?
a
or-
HUD. That's it, yeah. You have to be financially eligible and there's a lottery to get there. But to answer to your question, I find that most of the people that are more willing to go on to Medicaid at some point because it opens up services for them. So if they're living home and independently, you can get Medicaid services up to 24 hours a day. It's just a matter of how you handle that. I know it's not desirable to you, but I talk to people every day who that's the decision they make. They don't want it, but they see what it opens up for them in terms of opportunity. But I think that's a fair comment you make about life in general, where there's always sometimes something for this and for this, and the people in between sometimes are sort of lost at sea. That's not just unique to us, but.
At least in housing, at least they're attempting to make some concessions by having a certain percentage of affordable, if you want to say affordable, but certain percentage of a construction site, keep a couple apartments for us working folks.
Well, there are, requirements now from the city when you're building new buildings to have certain set asides, so 80/20s or whatever, so there are things in place for that.
Not here.
Not currently, no.
Okay,
Let's
that's.
see, the way next thing is, wait, hang on. Georgia Santiago has her hand up. You have a question, Georgia?
Yes. Yes. I would like to know, I know Julie mentioned working people, but what about, say for person that's on, only has Social Security? How would that rate it all?
If you're on Social Security. So I
That's
think
Social
that's her main income is Social Security.
Well, you can be on Medicaid and just, if you have a pension or certain things that get put aside, and you go into Medicaid at that point.
Medicaid? I thought
A lot of people-
Medicaid was very for the almost, you can't have anything.
Well, it depends on your resources. Yeah, that's true. You have to be impoverished to be on Medicaid. That's true. Back to the same point you're raising of this gap of people who don't want to be impoverished, don't want to give up owning properties and so forth, and want to have options.
Can you be on social
I
security and get Medicaid? I don't know about that.
I don't know what the economic threshold is at this point.
But if you're going into a nursing home, you're gonna,
You can turn it over.
Turn that over, you
Turn
$50
that
a
on.
month.
Same way like a pension, you're gonna turn it over because they don't want you
you have Medicaid.
purposes.
Right.
They don't want to fund you when you have other resources available to you.
Then Georgia may have a shot then, since she only has, if she's talking about herself or whoever is on social security. then-
Yes.
Then you would have a better shot than the rest of us.
We have a
Don't
theme here.
say that. I kind of
I
doubt
also want to
that.
recognize
Julie.
we have, sorry, Georgia.
No, I
Ms.
was just
Estevez.
saying, I kind of doubt that. Thank you.
Sure.
Thanks, Georgia. Ms. Estevez, did you
You're
wanna, say something on the, meeting? Ms. Estevez?
No, I was just listening, and you never know. So that's why I'm asking the question, because that's, basically what I have is my Social Security. And I know if you go into facilities like nursing home, which God forbid, but you never know, that that's when they would take even that Social Security. That I know.
Contact number
So I
5.
was just asking for myself.
Contact number 4.
Oh, Georgia, so she could talk to someone.
Okay, sure.
I don't know.
Yeah, definitely. Georgia, I will get back to you with a contact person. I'll give you a call. and,
Okay. Okay, thank you.
Thank you, Georgia. Ms. Estevez, did you want to say anything to the meeting?
No.
No, I appreciate it.
Hi.
That's it.
I-
I appreciate it because what I was listening to. I'm sorry, did you call in on someone else?
Yes,
yeah.
yes, Georgia, thank you.
Oh, I'm sorry.
All right,
Okay, thank you.
Okay.
I have no questions, but thank you. for
Thank you,
asking.
Ms. Estevez.
Two things about, swinging the services to more sustainable services. Would you be growing your short-term?
That's gonna stay the same. It's about 90 beds. The way the state looks at those beds, they consider those nursing home beds. So when I talk about subacute from the state standpoint, from the way they manage them and oversee them and regulate them, they're considered nursing home beds. I call them something differently because the people that go into those beds are here for a different purpose, but they are considered, yes. We have alumni, they get to go home, yes, but they are considered nursing home beds, and there's 90 of those.
Medicare though, not Medicaid, so is there a different?
There's managed care and there's Medicare. There's a better reimbursement for those patients
I'm getting so
than the
confused
traditional,
today.
they're not on Medicaid.
Right.
Right, it's a
Right.
Medicare.
Correct. It's the only time you really touch Medicare, which is sort of untapped when Medicaid goes sort of overused, and Medicare covers you when you're coming out of the hospital or rehab, though they don't cover as much as they used to. They used to give you 20, 30 days, 40 days, there's, can be up to 100 days, but they kick you off the program much sooner, which is a sidebar issue. Or leaving here, when you've been here for rehab, it's now time to go home, Medicare will pay for you for a little bit of time at home to transition. It's really transitional care, hospital to facility, facility back home, for the purpose of making sure you don't bounce back to where you came from.
So I was aware of another facility, different, but it's sort of trying to shift the long-term care beds to short-term.
For the reasons,
Subacute.
for the reasons we're talking about.
Right, right.
And that's where the for-profits do a very aggressive job
Yeah.
of taking in many more of those patients with a higher reimbursement and doing much less of long-term patients. That's what I was alluding to before.
Just the downsizing of the beds from 600 to
That's over a period of time. It'll be about 607.
800, wasn't it?
It was 1,100.
It was 1,100.
We had the Baptist home, the Fairfield home. We were a much bigger organization.
Forgot about that.
The only thing I could tell you is because I deal with the board directly now as the CEO, and there's a commitment on our board standpoint that it's our founding business to do it. We're just doing it in a manner in which we can afford to do it and not be disappearing like the other not-for-profits.
I'm just finding it so amazing the difference. They only pay you 300 when it's cost us 400.
That's,
And it's,
we're
wow.
not unique in that. I mean, that's everywhere. It's just
Yeah, but-
insufficient. The care is more expensive
Yeah.
because not only are you paying more, nurses have become much more expensive than they used. Forget about the CNAs on the contract. The nurses, many of them want to work for agencies. They don't want to work in a union environment because they can make more money without paying dues. We have to pay agencies to get nurses. So you're paying more and more. And, we don't have the reimbursement to back that up. So it's, think of any business you run where your costs are going one way and your revenue stays stagnant. You can't do business that way.
Very informative.
Yeah, but not the best answers. I'm sorry. I mean, all I can tell you is the truth.
It's been very productive, and really great.
They're good answers because
Yeah, no,
they're informing us.
and
By the way, I'm a member of, this community by work, by my life, been here for 27 years before I got married. So anything I can ever do for the committee, or if you ever need me to come to another meeting, or
we'd love it.
anything I can
Very
ever do
productive.
to participate and support the
It
work.
was
you
awesome,
do.
very informative.
Okay,
Really loved it.
all right. I'll leave and let you conclude your meeting. Nice to meet you. Nice to meet you.
Thank you. Have a wonderful day.
David, thank you so much.
Always happy birthday, Dave Vance.
Thank you.
Okay.
Thank you. Thank you for the work you're doing. Nice to see you.
Thank you.
Pleasure.
Thank you for the work that you do.
Thank you very much. I appreciate that. Have a great day.
Thank you.
Me too.
Eat the cookies, because otherwise
Otherwise-
I'll be back.
Okay, so I'm gonna circle back to the approval of the minutes, because we skipped over that. Did we mail Georgia a copy?
Yep.
Yes?
Yes.
Okay, so
Yes.
we have to vote on April and May minutes. Can we do them together? Or as a, okay. So, Georgia, it's like we were voting in American Idol. So, no abstentions, right? No disapproval?
No, I don't think
We
so.
want
no.
discussion on minutes.
Oh, I'm
first.
sorry. Do you need to discuss anything on the minutes?
No, dear.
Okay, and so do you abstain from them? Or disapprove?
I
So,
would
George,
approve.
here's a big question. Do you approve of both minutes, April and May?
Yes.
Thank you. And I approve. So Mary Ellen Gibbs and Georgia Santiago approve, so they're unanimously passed. Okay, now we go on to new business. Does anybody have anything to add? George, you have any new business you'd like to add onto our committee?
Oh, no, I don't.
Anybody here would like to suggest some stuff on the new business? Would you like to,
Are you looking at
and
me?
you-
Oh, Lisa?
Lisa. No? Would you like to see anything for us to work on?
Well, I mean, what's going to happen with budget requests, but.
Yeah, that's what yeah, well, I'm gonna, eventually we'll send a letter here and to other places. And as we go
We're
to,
talking for 2020.
what's seven? Right.
Okay.
So
that's
as I
a
go to
start,
these
yeah.
different meetings, well, I should have asked David when he was here, get an idea, but I get a later time, we can send him an email. Well, they have different things, like with the dementia people. One of the things that I thought was really cool they have these cats that really look like cats, and they purr and you hug them and they really feel like you have a real animal. And
I
they,
don't think
so they-
the city can fund.
stuff like that,
you
no?
know, It might be for.
Or for arts and
older
crafts
adult
stuff?
Centers that
Right.
report to sort of different.
Wait, well,
We need
Well, one of
desperately need money for vehicles.
Well, that's what,
Vehicles.
So that was just.
that was
added.
just put in, that was just put in.
Thank you.
And it was a shared thing with RSS and
In the Riverdale Y.
and the Riverdale Eye, yeah. We did put that in on actually our last board meeting. I got it in. Well, different, because actually another facility had asked for stuff and we put that in for expense, even though that was a nursing home rehabilitation. They asked for different stuff.
But I don't think we could and I could be wrong, but I don't think we could ask the city to fund either nonprofit or for-profit nursing facilities. You know, they're agency requests, you know, so from the department, I forgot what it's called now. Not DIFTA.
Well, you don't ask, you don't get.
Well,
You know?
it's the
Say
aging.
no.
NYC aging.
Right, NYC Aging, thank you.
Yeah.
I didn't know that.
So when I go to different places, I'll be asking them, different things, different agencies that I'll be going to, like different, like the Riverdale Y. I would like to hold a meeting there as well.
Yeah, so one of the issues, we'd be happy to host a meeting, but in the past, we haven't because the meetings are late in the afternoon and every single room in the building is taken up by after.
Well, that was one of my questions I was gonna ask.
Right, so,
If
Same
we
with
were
Laura.
to.
unless it's
book our-
on a holiday.
If we were to book with the Riverdale Y, is there any reason why we can't change the time to 2 o'clock for that day, or it has to remain at 4 o'clock?
It's you and the
It's up to
committee.
your committee.
You're the chair, you said it.
So I could, so for that one, if we came to you, I could actually possibly change the time to 2 o'clock. Like it used to,
Right.
it used to be at 2 o'clock,
Right,
we'll
because
do the Evelyn Wood speed.
So we do have a full board meeting next month, I believe, at the Riverdale Y.
they're probably in the evening.
Yes, in the,
After
After the kids leave. Because they take over. I mean, our senior center, although we're listed as being open till 4:30, I mean, we're there, but it's basically at 2:45, the kids start coming up and they take over all the rooms, so we don't have any activities in the afternoon because there's physically no space.
Right, oh, I remember how, because I was in theater program,
Ah,
so I remember how we used to find rooms, all right, we gotta rehearse the tap dancing here, so let's squeeze into this room and get this number done. And it's like really funny trying to get this big number done but yeah, you guys are really tight in your space, because you do so much wonderful things in there, there's so much going on there. And your senior program is wonderful.
Yeah.
Yeah.
if George was okay with it, you should,
So Georgia, if we had a
Yes,
meeting
yes.
at the Riverdale Y, would you up to changing the time to maybe 1 or 2 o'clock that day? Georgia?
It's hard to say for me.
well,
But-
when we have a date.
I would just go along with 2 for now, okay?
Oh, okay.
Okay.
Very good. Thank you, Georgia, because we want to try and get into all the places, and this way they get to know
I
us, get to
understand.
know them,
I
see their needs
understand.
and wants. It'd be nice to, take our show on the road here.
do me a favor so I can, and I'm gonna give you my card and you'll email me.
Absolutely.
And I can find my card. I have my cards. Just,
We should have your email now.
yeah, I'm on your email list. Right, so if you just email me and then
Because I
I'll,
wanna
and then I'll
check that
talk to the
too.
person in charge of it.
Very good.
And I can ask the after school if we need a little more time
Yeah.
to hold the kids in another room for.
Right, very good.
Yeah, if you can, Artie will usually connect from the office with Mary Ellen and you.
So
Well, sorry. I got a whole bunch of-
So are we finished with new business? Anybody else wanna
Sure.
talk about anything on new business? Chair? Madam Chair?
No, I'm good.
Madam to Madam? Anybody else? I'm gonna go to that now. Okay, any old business? Georgia?
I'm looking here. Sharon. No, I was just reading over something quickly here. I'm fine with the way it is. Was. The way it was
Okay, thank you so much,
presented.
Georgia.
Thank
Anybody
you,
else
dear.
on old business? All right, I think that kind of wraps it. New Georgia. Here's
Yes,
another
dear.
question. Do I have a motion to adjourn? Do I can
Yes,
make a motion
you
to
have a
adjourn?
first- first motion.
Okay, then I
I
second.
motion that is, okay, I'm seconding and first, so first and
All right,
second.
very good, Georgia.
Sorry about that.
Thank you so much, Georgia.
I just wanted
Everybody who are
I
on the
just
line.
wanted to say hello to Sharon.
And thank you so much to the Hebrew Home and David Pomeranz for hosting us here today. This was an amazing meeting today, very informative. I learned a lot and he had a lot of questions for us. And thank you so much, Hebrew Home River Spring Living.
I'm gonna stop the recording.